Because, well, remember, it's not a comfortable thing to do to stutter. People who stutter, especially in the childhood years, really wish they wouldn't do that. They would like it to stop, and it's embarrassing to them. So we're not doing this to confront the child with this stuttering and say, oh, look what you did there, you blinked your eyes. It's not that at all. Please approach this as an exploratory process, a learning process. They're not doing anything wrong when they stutter. We're going to approach this with curiosity. Let's see if we can learn about it. Let's see if we can understand it. Let's see if we can make sense of what's going on with your speech machine. Because the more we understand what's going on with the speech machine, the better prepared we'll be to try to change what's going on, right? And that's what the kids ultimately want to do. Another piece of this harkens back to that notion of the loss of self-control. The fact that when people stutter, they know what they want to say, but for some reason, in that moment, they can't say it. Well, having a better understanding of what they're doing during that moment of stuttering will help to reduce that sensation of loss of control, will help to reduce that they often feel, right? So we're exploring here. We're not trying to gotcha. We're not trying to let them know all the things they do when they stutter. Please don't approach it that way. This is exploration, and it is a curiosity that we want to satisfy. Modeling that approach to talking about stuttering with kids who stutter helps them see that this is something that we can approach without fear, without discomfort, without recrimination, without feeling like we've done something wrong. Stuttering is just something that happens sometimes in our speech, and we're trying to better understand it. The more we understand it, the more we can move toward changing it. We also want them to understand what they're doing when they're not stuttering. What do you do with your speech machine when you're not stuttering? And some kids will start off, well, I just talk, right? And that's going to be important because remember all of those internal thoughts that we were exploring before, the affective and cognitive reactions, the behavioral reactions when people are not stuttering. They're not avoiding, they're not tensing, they're not fearing, okay? And the muscles are working together. So we play around with when they're ostensibly fluent, and we compare the tense muscles during stuttering to the more cooperative muscles, cooperative with one another, more coordinated muscles during not stuttered or perceptibly fluent speech. A little bit later on, I'm going to talk to you about what I mean and why I'm careful when I use the word fluency. For now, I'm sort of equating fluency with not stuttering, but I'm going to come along later on and change that so that you can see one of the ways that we're seeking to view stuttering in this more modern era and what stuttering is and what stuttering is not. But for right now, at this stage of the child's development, it's okay if we talk about not stuttering as being roughly equivalent to fluent. It's not the same, though. Bear with me for that. That's coming soon. After we have helped the child understand what he does when he stutters, now we're ready to begin to help him try to change it. But of course, the child may feel helpless during that moment of stuttering. Remember, the loss of control. And they may not even realize that they can change it. They may feel like, oh, when I stutter, I'm just stuck. There's nothing I can do. And I have to try to push those words out. But we know that pushing increases muscle tension. So we're going to help them begin to learn that they can change the stutter in a different way that makes it easier for them to talk. They may not recognize that. They may feel like, uh-oh, I'm stuck. I got to push as hard as I can to get out. And indeed, that works. It works. It really does. There is no stutter that has lasted forever, right? Or else there'd be some poor kid somewhere still stuck in that block. No, a stutter eventually ends no matter what. And because the child often pushes to get the stutter out, they're reinforced for pushing. They think that pushing hard makes the difference. But what we're going to teach them is that another way to get out of a stutter is to ease their way out. Those who are familiar with Van Riper's pull-out strategy, which I tend to call easing out instead, will see where we're headed with this. If you can reduce physical tension and move forward, that's essentially pull-out or easing out. But we didn't just say, all right, when you're tense, I want you to do this. We're building it up foundationally, step by step by step. And then we have them, after they've got this idea of tense and easy and that they can change how much physical tension they're using, then we move them into catching a stutter, increasing the tension, pushing really harder, decreasing the tension. Yeah. Now, self-monitoring skills take time to develop. They may not easily be able to catch a stutter. I talked about that on the previous slide. It takes time to develop that skill. So here's where we get to introduce that idea that I mentioned I'd be talking about a whole lot, and I will be, pseudo-stuttering. Pseudo-stuttering is simply stuttering on purpose. Now, let's say it's fake stuttering. It's not real stuttering on purpose, okay? When I go like that, I'm not really stuttering. Even though I'm exhibiting a part-word repetition that has physical tension in it. And in a person who stutters, if they went like that, they would probably be stuttering. But when I do it, it's fake, not being a person who stutters. I can create the surface behavior and not experience that loss of control. See, that's the key. Non-stuttering speakers don't experience the loss of control. People who stutter sometimes do. Not always. Because people who stutter get to have regular disfluencies too, just like people who don't stutter. Okay? So the idea behind pseudo-stuttering is to create that physical tension, and then we can use that to learn about the physical tension. So with pseudo-stuttering, we can do high stuttering, like this, and low stuttering, like this, and long stuttering and short stuttering, and loud stuttering and quiet stuttering. And in particular, relevant to this idea, tense stuttering and easy stuttering. This allows us to practice over and over and over again, because the child's going to need that, changing tension in stuttering. This helps the child understand more about what he does when he stutters as he plays around with different ways of stuttering. And it's also highly desensitizing. As I mentioned, I'll talk a lot about desensitization later on, but this lays the foundation for some of that work. You'll notice that everything I've been doing so far in treatment goals number 1 and 2 is foundation building, helping to prepare the child for making changes in his speech. I have not yet asked him to actually do anything with his speech in the real world, because he's not ready to yet. And if I do ask him to do stuff out there, he's not going to be able to do it. Generalization fails, and he gets discouraged, and the parents get discouraged. So I highlight for the student that right now we're going to learn. We're going to start off learning about stuttering, because the more we learn about stuttering, the better prepared we'll be to make a change.